Welcome to Introduction to Injuries, Common Ailments, and Best Practices. So here is the pitch why you should be excited to learn about injuries. Yoga is a physical practice. As such, it is subject to the limitations and occasional mishaps that befall physical practices. In short, injuries. Understanding the pathology of injuries commonly seen in yoga class will empower you to suggest some common sense modifications for your students, as well as to recognize your own scope of practice. Doing this will help you to keep your students safe and support them on their road to recovery. So, here are some learning objectives for this module. By the end of this lesson, you will be able to define a yoga teacher's scope of practice regarding injuries. You will be able to compare a chronic and acute injury. And you will be given an injury or create an offer, a common sense modification to support students to move in pain-free range of motion. You'll use effective compassion and clear communication when speaking with your students about their specific injuries. Let's talk a little bit about the scope of practice. The scope of practice statements are the concise descriptions in broad, non-exclusive terms of each regulated professional's activities and areas of professional practice. These statements describe in general what each profession does and how it does it. This is from the British Columbia Ministry of Health. So note the complete definition also includes they are not exhaustive lists of every service the professional may provide, nor do they exclude other regulated professions or unregulated persons from providing services that fall within a particular profession's scope of practice. From the U.S. Yoga Alliance scope of practice, we will look at Principle 5, which is advise and teach within permitted scope. In the Google Classroom, you will see a link in this module with the full statement from the U.S. Yoga Alliance scope of practice. But we're looking right here at scope practice number 5. So principle number 5 prohibits members from advising or teaching in areas where the member does not have appropriate credentials or competence. The goal of Principle 5 is to provide guidance in cases where members may encounter situations beyond the scope of their credentials, experience, or abilities. 1. Members must not provide advice or services for which they are not properly and currently licensed during any program, including residential or immersion. Members may, at their own discretion, provide referral lists of locally available resources for students, including but not limited to medical and mental health professionals, law enforcement, suicide prevention hotline, sexual abuse hotline, and Yoga Alliance. Unless the member is both competent and properly credentialed in the specific field in which they seek to provide services, advice, or products, the member must 1. Gain competence and proper credentials, and 2. Engage the services of or refer the student to a competent and properly credentialed professional, or 3. Decline to provide such service or advice. Yoga Alliance credentials must never be used to imply competency or to promote the member in the fields not specifically included in the Yoga Alliance scope of practice. So, understanding our scope of practice. Have you ever asked or heard someone ask a teacher about injuries? You may have. We assume our yoga teachers have a lot of knowledge about the body. Often students feel more connected to their yoga teachers than their doctors, chiros, or physiotherapists. However, do students always tell their yoga teachers about their injuries? Definitely not. So what do you think our scope of practice is as a yoga teacher? Trained, we are to lead healthy people through a safe yoga practice. We teach asana and we teach pranayama. We teach meditation. We're trained to know modifications or variations and help the asana become more accessible. We're trained to Are we trained to diagnose, assess physical conditions and injuries? Absolutely not. We teach smart yoga. That's it. So, what does understanding your scope of practice as a yoga teacher offer you? It should offer you a clear framework to understand the limitations of your own knowledge and responsibilities. And it should empower you to refer students elsewhere when they're asking to perform outside of your scope. This should also empower you to put the power back into the students' hands for their own well being. We want to remember in the scope of practice to lead healthy people through a safe yoga practice. We want to offer students common sense modifications, and we want to empower students to move in their pain free range of motion. So, what is your scope of practice as a teacher? Given our scope of practice, it's important to empower your students to take responsibility for their own health, their choices, and their pain management. Empower them to modify their practice as needed. Only they really know what their body feels like. And refer students to outside practitioners with the appropriate expertise. Never contradict a specialist's recommendations. Your job is, given the information you receive from your student, offer common sense modifications that will help them to stay pain free. Communicating about injury. Given that our scope of practice with injuries is fairly limited, why is it helpful for us to ask students if they have injuries? It informs you why a student may be modifying the practice so you don't overly correct them. And if you do hands on assists, it helps to ensure that you either don't touch them or that you touch them safely. Having this information enables you to offer common sense suggestions or modifications. Often, when students tell you that they're working with an injury, they feel more comfortable, empowered, modifying their practice because they won't worry that you think they're being a bad student. So, how do you think it's best to communicate with students about injury? Let's talk one on one before class, where given all of the opportunities. If possible, avoid asking the class as a group, as not everyone wants to talk about their injuries publicly. What are good questions to ask your students if they tell you about an injury? Ask them, have you seen a healthcare professional, doctor, chiropractor, physiotherapist, or more? What did the specialist recommend for or against? How long have you been practicing with this injury? What range of movement makes it worse or better? Are you comfortable modifying to work in a pain free range of motion? What movements make it worse? What movements make it feel okay or better? What information should you provide the student? You want to give them permission to modify their practice and trust their bodies. Give them the responsibility for their practice and well being. Offer common sense modifications for poses as appropriate. And should you ever kick a student out of class? This question may bring up interesting conversation, but there's no right answer. It really depends on a studio's policies. The following bullet points are just my 2 cents. In my opinion, I don't kick students out of a class. They often come for a safe space to be as they are and for community. If a student is doing something potentially injurious to themselves or others, I will not hesitate to stop them. Let's take a look at acute versus chronic injury. Acute conditions are severe and sudden in onset. This could describe anything from a broken bone to an asthma attack. A chronic condition, by contrast, is a long developing syndrome, such as osteoporosis or asthma. An acute condition is usually when an injury has occurred within the last 24 to 48 hours. A chronic condition is persistent and continues for more than a few months. Students with chronic pain are sometimes never completely pain-free. Our goal then as yoga teachers is to not increase their pain levels. So what are examples of an acute condition? We have broken bone, immediately sprained ankle, open wound or a cut, traumatic injury, allergic reaction, shoulder dislocation. What are examples of a chronic condition? We have arthritis, cancer, recovering from a sprain, recovery from a knee injury, spinal issues, whiplash, scar tissue, osteoporosis, recurring shoulder injury. Which injuries are more likely to see in a class? We are more likely to see something that's chronic. Our students would not likely be in an acute phase, as acute issues need immediate medical attention. However, it is common to have chronic injuries in class. When we look at the active recovery, ARITA, a common protocol for injuries, used to be RICE, rest ice compression elevation, which results in stabilizing, cooling, and compressing tissues as a way of mitigating against inflammation. However, this protocol has been challenged by the ARITA method, ARITA, which proposes that active recovery, mobilizing the areas it heals, has a far more beneficial effect. Increasingly, healthcare practitioners are encouraging injured patients to move rather than remain stationary. Sensible mobilization helps to flush the fluids in the area through movement to support lymphatic function. It prevents the buildup of scar tissue as well. Because active recovery is considered beneficial, you may have students in your class who are actively recovering from injury. Sometimes students will be told by their medical provider that they must move into a painful range of motion as part of their recovery. For example, frozen shoulder. Encourage students to follow the parameters given by their healthcare provider. The moral of the story, the focus of this lesson will be an overview of some common injuries so that you will have a language for understanding your students' experience and be able to offer them common sense modifications that support them to move in an appropriate range of motion. Here we're going to look at some different categories of injuries: spinal issues, ligaments and joints, muscles, inflammation, fluid issues, repetitive stress injuries from yoga. For almost all of the following issues, a student handout contains a description of the issue, but then there is a blank space for students to enter common sense modifications. You, as a student in the 200-hour certification program, will find this handout in the Google Classroom where you can complete this homework and upload your answers.